If you are over 60 and taking medication for high blood pressure, there is something important that research suggests you may not have been fully told. According to the Mayo Clinic, many of the most commonly prescribed blood pressure medications come with side effects that are particularly pronounced in older adults, including dizziness, fatigue, frequent urination, and an increased risk of falls. Yet National Institutes of Health data indicates that tens of millions of American seniors are taking these medications, often multiple ones simultaneously without a complete understanding of their effects, their interactions, or the lifestyle interventions that research suggests may complement their treatment. This video is not about stopping your medication. Please do not stop or change your medication without talking to your doctor. This is about making sure you have the information you deserve. Let's go through what the research actually says. First, why does blood pressure tend to rise after 60? Research from the National Institutes of Health identifies several age-related factors that contribute to hypertension in older adults. The first factor is arterial stiffness. As we age, the walls of our blood vessels naturally become less flexible. Mayo Clinic research indicates that this reduced elasticity means the heart must pump harder to move blood through the body, which raises systolic blood pressure, the top number. The second factor is kidney function changes. The kidneys play a central role in regulating blood pressure through fluid and sodium balance. Harvard Health research indicates that kidney function typically declines with age, which may contribute to blood pressure increases. And the third factor is the accumulated effect of lifestyle. Decades of dietary sodium, physical inactivity, and weight changes contribute to a blood pressure trajectory that often becomes medically significant in the 60 and 70. Understanding these causes matters because some of them may be addressable through lifestyle interventions, which we will cover in detail. Now let's talk about the medications themselves. Because research suggests that being informed about what you are taking and why is associated with better health outcomes. According to the Mayo Clinic, the most commonly prescribed blood pressure medications for seniors fall into several categories. The first category is ACE inhibitors and ARBs, such as lisinopril and losartan, which work by relaxing blood vessels. Research indicates they are generally well tolerated, but may cause a persistent dry cough in some individuals and require monitoring of kidney function and potassium levels. The second category is beta blockers, such as metoprolol, which slow the heart rate and reduce the force of heart contractions. Cleveland Clinic research notes that in some seniors, beta blockers may cause fatigue, cold extremities, and in some cases, depressive symptoms. The third category is diuretics, sometimes called water pills, which help the body eliminate excess sodium and fluid. National Institutes of Health research indicates they are effective but may contribute to dehydration, electrolyte imbalances, including low magnesium and potassium, and frequent nighttime urination, which in seniors increases fall risk. And the fourth category is calcium channel blockers, such as amlodipine, which relax blood vessel walls. Mayo Clinic data notes that ankle swelling and dizziness are among the more common side effects in older adults. The important message here is not that these medications are bad. For many seniors, they are essential and life-saving. The message is that if you are experiencing symptoms that seem unusual, dizziness, fatigue, confusion, frequent falls, your medication may deserve a closer look with your doctor. And the third factor is the accumulated effect of lifestyle. Decades of dietary sodium, physical inactivity, and weight changes contribute to a blood pressure trajectory that often becomes medically significant in the 60 and 70. Understanding these causes matters because some of them may be addressable through lifestyle interventions, which we will cover in detail. There is one side effect of blood pressure medications in seniors that deserves particular attention, and that is orthostatic hypotension. This is the medical term for a sudden drop in blood pressure when you stand up, which can cause dizziness, lightheadedness, and in some cases, falls. According to the National Institutes of Health, orthostatic hypotension affects an estimated 20% of adults at 65, and blood pressure medications are among the most common contributing factors. Harvard Health research indicates that falls related to blood pressure medication are a significant and under-recognized cause of injury in older adults, including fractures, head injuries, and hospitalizations. If you experience dizziness when standing up, particularly after sitting or lying down for an extended period, this is something to report to your doctor. It may indicate that your medication dose needs adjustment or that a different medication may be more appropriate for your current health status. A simple test called orthostatic blood pressure measurement, where your blood pressure is taken lying down, sitting, and standing, can help identify this issue. Approach number 1, the DASH diet. Research from the National Institutes of Health's National Heart, Lung and Blood Institute suggests that following the DASH diet may reduce systolic blood pressure by up to 11 millimeters of mercury in some individuals, a reduction comparable to that produced by certain medications. The DASH diet emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy while limiting saturated fat, added sugars, and sodium. It is not an extreme dietary change, but research suggests even partial adherence may produce meaningful benefits. Approach number 2, sodium reduction. Mayo Clinic research indicates that reducing sodium intake to under 1,500 milligrams per day may produce meaningful blood pressure reductions in older adults, particularly those who are salt sensitive, which research suggests is more common after 60. The challenge is that most dietary sodium does not come from the salt shaker. It comes from processed and restaurant foods. Reading nutrition labels and reducing packaged food consumption are the most impactful steps research supports. Approach number 3, magnesium. Several studies reviewed by Harvard Health suggest that magnesium deficiency common in seniors, particularly those taking diuretics, may contribute to elevated blood pressure by affecting the ability of blood vessel walls to relax. Research suggests that correcting magnesium deficiency through diet or supplementation under medical supervision may support healthier blood pressure regulation in deficient individuals. Foods high in magnesium include dark leafy greens, nuts, seeds, and whole grains. If dietary sources are insufficient, your doctor can test your magnesium levels and advise on supplementation. Approach number 4, moderate aerobic exercise. Cleveland Clinic data suggests that 30 minutes of moderate aerobic activity on most days of the week may reduce systolic blood pressure by 5 to 8 millimeters of mercury in some older adults, a clinically meaningful reduction. The keyword here is moderate. Research suggests that low to moderate intensity exercise such as brisk walking, cycling, or swimming may produce blood pressure benefits without the risks associated with high-intensity activity in seniors with cardiovascular conditions. As always, get medical clearance before starting an exercise program if you have heart disease, uncontrolled hypertension, or other cardiovascular conditions. Approach number 5, home blood pressure monitoring. National Institutes of Health research indicates that seniors who regularly monitor their blood pressure at home may achieve better blood pressure control than those who rely solely on office measurements for one important reason. Blood pressure varies significantly throughout the day, and a single office reading may not capture the full picture. Harvard Health recommends measuring blood pressure at the same time each day, ideally morning and evening in a seated position after 5 minutes of rest. Keeping a simple log to share with your doctor may help enable more precise medication adjustments. A reliable upper arm blood pressure monitor is available for well under $50 at most pharmacies, and may be one of the most valuable health investments a senior can make. A critical reminder before we close: there are blood pressure situations that require immediate medical attention. According to the Mayo Clinic, seek emergency care immediately if your blood pressure reading is a 180 over a 120 or higher, particularly if accompanied by severe headache, chest pain or shortness of breath, visual changes, numbness or weakness on one side of the body, or difficulty speaking. These may indicate a hypertensive crisis, a medical emergency. For non-emergency concerns, if you are experiencing dizziness, fatigue, swelling, or other symptoms that may be medication-related, contact your doctor and do not adjust your medication on your own. Let's recap what research suggests may help support healthy blood pressure after 60. Number 1, the DASH diet. Research suggests up to 11 millimeters of mercury reduction with consistent adherence. Number 2, sodium reduction. Target under 1,500 milligrams daily. Number 3, magnesium. Get tested, particularly if you're taking diuretics. Number 4, moderate aerobic exercise. 30 minutes most days may produce meaningful results. Number 5. Home blood pressure monitoring. Daily tracking may help your doctor optimize your treatment. And most importantly, have an open conversation with your doctor about every medication you are taking, every side effect you are experiencing, and every lifestyle change you are considering. You deserve to be an informed participant in your own care. If this video helped you, please like it, subscribe, and share it with someone you love who is managing blood pressure. We publish new evidence-based senior health content every week. We will see you in the next one.